Hi, Dr. Frega here with Ideal Health and Wellness. And like we talked about last week, we will be doing a two-part video. The first one we talked about low back pain in pregnancy and different ways that we can treat it. And then this week we're going to actually show you what Webster Technique looks like. And again, just to remind everybody, Webster Technique is a specific chiropractic technique used to treat low back pain in pregnancy. So again, like we talked about, a lot of women can get a lot of tension through the low back, that some might even get radiation and referral down into the leg. And again, what this technique is going to do is address the skeletal, muscle, and ligamentous aspects to all of that. So when I have somebody come in, we first kind of do our assessment here, and I'm kind of looking just kind of at the sacrum here and seeing where the restriction is. So hers is actually on the right side. So what I do here is we're going to do a drop table technique. So you will hear the table as it drops, which sounds a little bit louder and then the technique is actually a gentle technique. So it always sounds loud, but again, it is a pretty gentle technique. Just a gentle contact point and then straight down. And again, it's very gentle on mom. All right. And then what I do is I usually kind of just assess kind of the musculature going along that lumbar spine there. A lot of times there's a lot of tension. So we'll kind of do a little muscle work to help work that out here. And then the other muscle that we'll work is piriformis. So it actually starts by inserting on the sacrum, and it's going to come and insert down here. So with the piriformis, typically both sides are tight. One might be more tight than the other, but if mom's also having some referral pain down the leg, it can be because of the sciatic nerve. So sciatic nerve will either go under, over, or pierce through that piriformis muscle. So helping to loosen that up will make a big difference and can help alleviate some of that referral pain down into the leg. So again, everything's really gentle techniques. We're just kind of working on loosening up the muscle here. And I will do both sides. Okay, and then the last thing while she's face down is that we do the sacrotuberous ligament release, and this ligament is located on the bone when you're sitting down, right on that ischial tuberosity. So again, we kind of do, it's about 10 seconds of holding the pressure, help get that to release, and then we'll have mom flip over here. So you can go ahead and flip over. Okay. Your knees bent here. And again, when mom is laying on her back here, what we're going to do is assess that pubic symphysis area here. Again, with relaxin, as you're having more of that in your system as you're progressing through your pregnancy, we can get some shift in that pubic symphysis that can cause some discomfort. If there's a little bit of shifting, again, it's just a very light, gentle adjustment here. There are a couple of different ways we can do this. I find this the most gentle though. And then again, if mom's having issues with that, I'll send her home with an exercise too to help with that. What we do then is kind of look at the round ligaments here. And again, those are the ligaments that are attaching onto the uterus. So again, as uterus is expanding with baby, those tend to get really tight. And again, can cause some pain, localized, or again, some can refer into those anterior thighs as well too. So again, here I'm not applying a ton of pressure, just enough to kind of help loosen those ligaments up and help them to relax. And then the last step would be is looking at, again, more of those hip flexors. So this is a muscle that is going to attach down on that lumbar spine. And hers are actually pretty good, so we don't even have to address those. If we did, what I would do is I would do some stretching to address those muscles. So that is Webster Technique. Again, it's great to help women alleviate pain, as well as help them prepare them for labor and delivery as well.